Hello, welcome to this video guide. In this Medway guide, I'm going to show you how to record a non-urgent request for advice from another clinical speciality. You do that using a clinical note in Medway. And so to get started, first thing we've got to do is find the patient for whom we want to raise that clinical note. So I'm going to search my patient because I know that she's an inpatient. If she wasn't currently in the hospital, I could use the master patient index, but she's an inpatient on the test ward. So I'm going to view patients by ward, and over in the search dialog, search for the test ward, press enter, double click on the ward, and here are the patients currently in the test ward. There's a patient I want to seek advice about. And what I need to do now is go to her home page by clicking the little house. And this is the electronic patient record for the patient I just selected. Always check you've got the correct patient at the top of the page. If your electronic home page for patients is not set up like this, do contact the IT service desk and a trainer will contact you to talk you through setting up your page. So you've got these lovely little windows of different aspects of the patient's information. I'm interested in clinical notes, so I'm going to click the Add Clinical Note button. I already have a patient note as one of my favourite clinical notes because I use this quite a lot. If you don't have it as a favourite, then what you need to do is find it because your page will be blank. Go to the template name, type patient, hit the search, and there are various notes that appear. You just got to make sure you click the star to make the patient notes one of your favourites. Once you've done that, it's on your list of favourite clinical notes. To create the clinical note, click on its name. Then I've got to tell Medway that I'm dealing with the patient's inpatient hospital spell. And here it's selected for me the consultant who's currently responsible for the patient. So this patient has a current inpatient spell. It started on the 25th of June at 10 to 11. It's currently open. She hasn't gone home yet. And now I just go down to the base of the page and click the next button. And this is the clinical note for requesting advice from another speciality. This note actually has more than that function. What you need to do is tell Medway which function you're interested in. So we're definitely interested in the non-urgent request for advice. So I put a tick in that box and the page appears ready for me to make that request for advice. The little red asterisk next to this page is telling me that there's mandatory information that I must answer before I'll be able to click the complete button at the base of the page. The complete button is greyed out until I've answered all the mandatory fields on this particular page. Click on the page. Okay, so here is the note, and what I now need to do is to fill in the details. Now it already knows who I am, so it's put my name in the logged on field. It's asking for my contact details, my bleep or my telephone number or both. I'm going to tell it my bleep number, 1234. That's the way that whoever responds to my request for advice can contact me. That's why this information is mandatory. Who's the patient's current consultant? That's I know the first name there. Where is she? Dr. Cardew. She's the current consultant responsible for my patient. I'm seeking advice from haematology. So I come in here and I go and select haematology. Further down the page, let me just scroll down. Relevant clinical information. This is where you give a bit of background to give the person you're asking a question to some information about the situation. So in my case, the child has possible sickle cell trait. results pending. Okay, bloods showing low B12/folate. There we go. And the question to be answered is, could, I'm going to get my spelling right, could sickle cell cause low folate/B12 results? That's all. If you know someone in the haematology lab, the specialty department from which you are requesting advice from, then you could name them in this box down here. In my case, I don't know anyone in the any of the haematology clinicians, so I just leave that blank. And what will now happen is that when I click the complete button at the base of the screen, this form will be emailed to the departmental secretary for haematology, who will then make sure that a responsible senior clinician answers this and responds to me using my contact details I put above here. Okay. And there's a completed clinical note, and that is how you make a non-urgent request for advice.